Actions speak louder than words. And today, while we're talking about making children healthier, there's a way you can make it happen. The Royal Children's Hospital Foundation supports research, education and expertise that impacts generations of children. And with generous support from the Good Friday Appeal, together they make this podcast possible. Every single dollar is an investment in healthy children. Search the Royal Children's Hospital Foundation to show your support. Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne, and your host today on the Kids Health Info podcast. In today's episode, we're going to be talking about common illnesses, in particular infections that might crop up in the first year of life with your new baby. And here to help us understand those and when we do need to worry and when we don't, we have Dr Danni Bao, paediatrician who works in general medicine and also in the emergency department. Welcome, Danni.
Lovely to be here. Thanks, Anthea.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So that first year of life, Danni, is so busy. Parents often find themselves worrying about sleeping or feeding or just getting to know their baby. And then on top of that, they might get sick. And that is not uncommon. What are some of the things that you see that might bring a baby into the emergency department when they're unwell in that first year?
You're right. It is really common and almost impossible to avoid in that first year of life. It's a completely normal part of typical childhood. So what's really important to know about is what's not so normal. Those common infections might be respiratory infections from the common cold to an actual chest infection where a child has difficulty breathing. Could be a gastrointestinal infection where you might see some vomiting and diarrhoea. This is where it's particularly helpful to keep up their hydration. Then there's the less common things like a urinary infection or even rarely meningitis or a bacterial infection where they can become much more unwell quicker.
So lots of different things that can happen and, as you say, are really quite normal most of the time. So for parents at home thinking, when do I really need to worry? What would be those particular red flags that something might be more serious?
In terms of red flags, I would be quite worried if your child wasn't waking for feeds, so they were more floppy or lethargic than usual. If they're not drinking well, particularly if you're seeing signs of dehydration, like significantly less wet nappies. If there are breathing difficulties where your child's struggling to breathe, or you might see that they're breathing faster or harder than usual. If their cough becomes more persistent and troublesome. Then there are the children where they might have a rash that doesn't fade when you press on it, or they could develop seizures. That's certainly more worrying and would warrant more urgent review. Okay, so lots of things there to look out for. And you mentioned the rash. I know we've talked about that in another episode as well, and people listening can always have a look or listen to that episode if they want some more information about rash. You just mentioned then as well seizures, Danni. So what might that look like in a baby? Obviously that's going to be very serious and a reason to seek urgent care. Absolutely. This can be so frightening for parents seeing it for the first time. And I want to really stress that seizures themselves are not harmful and they can be a sign that your child has a change in their temperature, and this can be happening quite quickly, and the immature brain is responding to that change. In terms of what it might look like, you could see a child being more unresponsive, or their eyes might roll back or to the side, and you can see some jerking of the arms and legs. This is typically what we would see, and some parents have even said they have thought that their child was dying in front of them. It can be that scary.
Yeah, very terrifying to see.
Rarely this can be a sign of a more serious infection affecting the brain, but more commonly it's in the setting of fever. And it's something that children do grow out of.
And so if a child experiences those symptoms, so they are having a fit or seizure or convulsion, that would obviously be a reason to have your child seen by a doctor.
Certainly, and also a reason to seek urgent review. So if you're worried, please call an ambulance.
Absolutely. And for parents listening who want to know a bit more about febrile convulsions in particular, so those seizures that can happen when a temperature is changing quickly, we've got another episode on that, so we'll put the link in the show notes.
And the other thing I want to emphasise is that it's not so much having to bring the fever down when a child has a fever. It's more keeping them comfortable because you cannot prevent these from occurring.
yeah, parents do try and keep their baby cool sometimes, thinking that that will make a difference, but actually that in itself can be harmful, can't it? So lots that we've covered already there, and we asked our audience what particular questions they have about illness in that first year of life. So we're going to hear from our producer, Alicia, now with a few questions so we can pick your brain for the answers.
This one's from Erin. Erin wants to know, what's the best way to protect my newborn when their siblings are going to childcare and kinder?
That's a really important question. Thank you, Erin. And I feel like a lot of parents worry about this and would prefer to wrap their baby in cotton wool. But really, this is unnecessary and almost impossible to avoid. So I would be encouraging layers of protection. So where one measure may not be perfect, layering of these measures can be really beneficial. So I would start with ensuring everyone is vaccinated, both your baby as well as the entire family. There are some additional vaccines outside of the schedule that are available, such as the flu vaccine and RSV vaccine, that I would be encouraging if your child is eligible.
Absolutely. And I'll just jump in there that, again, we've got an episode on vaccines for parents to listen to as well. So that protection's so important. And I think people forget that it's not just the baby, it's everyone around them as well.
That's right, that cocooning effect. And then I would be thinking about when your toddlers or children come home from childcare and school, making sure that they wash their hands and show their love in other ways. It might be pats and cuddles as opposed to kissing them on their face or their hands. I would be encouraging that visitors who are unwell be kept away until they're better. Also, when toddlers are sneezing, they're coughing away, ensuring that they aim to do so into their elbows, using tissues, and again, really careful hand hygiene can prevent the spread of infection. All those things that we got really good at during COVID. And then there's breastfeeding. Although it is encouraged, this is where possible, obviously, and it doesn't protect from all viruses, but does afford some protection to your newborn and baby.
Absolutely. So all of those things, as you say, rolled up together are going to work as best as we can to protect little ones. But in the end, some illness and infection is going to be unavoidable. And as we know, it's also part of building that immune response and the immune memory. Having an exposure to some of those things will ultimately give your child some natural protection for the future. All right, let's hear the next question.
This question's from Remy. Remy wants to know, when should I take my baby to the GP? And when should I go to ED? And when do we just ride it out at home with paracetamol?
I think this is a really tricky one for some parents, particularly new parents, to get their head around. And I want to stress that you know your baby best. And so if you're worried that something's amiss, then I'd much rather see your baby who turns out to be fine rather than miss something that genuinely needs help. So for a baby who generally is doing pretty well with their feeding and they are comfortable with their breathing and they're alert in between sleeps, I'd be very comfortable monitoring closely at home. I think it's really important, that idea of reassessment, because children can become more unwell quite quickly. In terms of getting a second opinion, there's lots of resources now. We've got Nurse on Call, we've got virtual ED, and so if you're having trouble getting transport to see a GP, these are other avenues you can reach out to. With the GP, I'd be thinking, look, I'm really not sure if my child's drinking enough. I'm worried about the level of their wet nappies. I'm concerned about persistent vomiting. My child is in pain. They're a little unsettled. I'm not really sure what to do. They're having some breathing difficulties from nasal congestion. How can I help this? They'd all be reasons to seek medical review. In terms of red flags and going to an emergency department, any child that's under 3 months of age, I'd be worried about. They have less developed immune defences and so can be quite unwell quite quickly. So any child under 3 months who has a fever, I'd be taking them to the emergency department. Any child who's struggling to breathe, and really that idea that they're working harder and faster than usual and you're worried that they're not getting in enough oxygen, they might be turning blue, for example. Any child that's really lethargic, floppy, difficult to wake, poorly feeding, there are other reasons. And then there's obviously the hydration. So does your child need support with hydration? We normally say if your child's not having fluids half to 2/3 normal, then really you should bring them in because they may need that extra support. Now, certainly if they're vomiting or have diarrhoea, then they're at greater risk and they need even more fluids. Again, that rash that doesn't fade when you press on it is a really concerning sign. So for those reasons, I'd seek urgent review.
Really helpful, very clear there, Danni. Thank you for that. Let's hear the next question.
This one's from Bire. Bire wants to know, I've heard about RSV. Is this a new virus that we need to be worried about?
You're right. RSV is getting a lot of media attention. Perhaps that's because there's a new vaccine available.
It's not actually new though, is it? It's been around a long time, this particular virus.
It certainly has. It's been around for decades. And we're actually seeing some changes since the introduction of the vaccine, and we're seeing less severe illness, particularly in the first year of life.
Yeah, it's really exciting to see the benefits of that. I know here in the hospital, it's early days, but into the winter we've seen less nasty RSV admissions or stays in hospital in young babies, and we really feel that's related obviously to that vaccine doing its job. So what actually is RSV, just so that people at home can understand?
RSV, which stands for respiratory syncytial virus, is a common cold virus and often will result in a runny nose, a mild cough, sneezing, and fever in your baby. It also affects young children, but most kids will have met with this virus in the first couple of years of their life. So it's very common and normal to pick this up. We're also probably hearing a little bit more about it because there is rat testing available and we can do this at home. We see it in emergency departments. We see it when children are admitted to hospital. It doesn't really change how we manage because when we see children with viruses, it's often that supportive treatment that's important. So these are all the things that you can be doing at home. And that's smaller, more frequent feeds, making sure that they're comfortable and that their breathing is also comfortable. That's the problem with RSV. You can get bronchiolitis or respiratory troubles, particularly in younger children. So if you are seeing that in your baby, please seek advice.
And so if a baby has developed perhaps that more complicated bronchiolitis or infection there in the airways, what will that look like in the baby? How will a parent know that it's more than just a cold?
It could be during feed times where your child's really having to pause and take breaks to feed. You might see it in the rate that they're breathing, so just quickening of their respiratory rate. And then you might see them sucking in between the ribs, up here just above their sternum, between their collarbones. Particularly in young babies, you might see them start to flare their nostrils, bob their head up and down as they're taking each breath. And this is all telling us that your child is having to put more effort, more labour into breathing.
And they'd be signs to get help.
They can get tired over time and it might be that they're not getting enough oxygen through to their system.
Okay. Good tips there on what to look out for, Danni, and of course how to try and help prevent RSV with that vaccine for those babies who are eligible as well. All right, let's hear the next question.
This question's from Samantha. How can I keep my baby comfortable when she's sick?
Great question, Samantha. And it can often be really worrying seeing your child with a fever, grizzly and miserable, and how you can support that. So really it's just making sure that they're comfortable looking at your baby rather than the number on the thermometer, ensuring that they're having smaller, more frequent feeds because they just might not have the energy to have that full feed, ensuring that you're keeping them comfortable from a temperature perspective, so dressing them in lightweight clothing, not too many blankets on, just like when you're hot with a fever. In terms of paracetamol use, this is more if they're miserable, if they're uncomfortable, and you see that it helps to perk them up. But paracetamol itself doesn't treat the infection. It doesn't make the infection go away faster. It's really a comfort measure, and I wouldn't be using it purely to try and get the fever down. We know that fever is a common response to infection and is actually a sign of a healthy immune system.
Absolutely. And what about ibuprofen? So sometimes parents ask about the difference, whether they should give one or the other, ibuprofen or paracetamol, and also whether it's safe to be giving both.
It is safe to be giving both, but I would be carefully reading the label because there are problems if you do give too many doses each day. So I tend to start with one or the other and add the second one in if you're finding your child is still uncomfortable despite the first dose. The important thing to know is that there's no real right way or wrong way to do this, and some might recommend alternating. First you try the Panadol, wait a few hours, then give the ibuprofen, wait a few hours, give the paracetamol. The important thing is ensuring that there's an adequate amount of hours in between the dosing of each. So for paracetamol, we advise that that's usually 4 to 6 hourly, maximum of 5 times per day, and that's a 24-hour period. And for ibuprofen, it's 6 to 8 hourly with a maximum of 3 times in a 24-hour period.
Great.
They work slightly differently and sometimes can be more effective when combined.
That's all really helpful advice and very practical for parents listening at home. Thanks, Danni. I think we've also got some information about that on a fact sheet too, which we'll pop in the show notes. So one of the other things that we really like to do on the podcast is bust myths, because there's a lot of misinformation out there, and, you know, parents are looking at things all the time, trying to do their best and learn as much as they can. When it comes to illness, particularly infections in the first year of life, what's the biggest myth that you'd like to tackle?
That fever always causes harm. Yeah, we hear that a lot, and we see that a lot in the worried parents who come into hospital. And I'd really like to reassure parents, particularly those who feel quite helpless and not knowing what to do, that this is safe. Fever itself does not cause brain damage. It does not cause long-term harm for your child. Fever is a natural sign that your immune system is activated. It is a healthy response to infection. So again, I want to urge treating your child, looking at your child, seeing how they behave. Are they drinking well? Are they breathing comfortably? Is their skin normal colour? Are they alert and interacting with you between sleeps? They're all really important ways to assess yourself how well your child is doing in the setting of an illness. And that really important part of continual reassessment, because sometimes children can get one virus on top of another, and sometimes when their immune defences are so hard working on treating their own viruses, a bacterial infection can come along. And really seeing an acute deterioration in your child, trusting that parental instinct where you're thinking, my child is actually getting worse than getting better, or any of those red flags that we mentioned would warrant more urgent review.
Yeah, really important and helpful advice, Danni. I think particularly in that under 1 age group, they are little, and as you say, things can change quickly. So if you feel like your child is going backwards or deteriorating or things are getting worse, then as you say, follow those instincts and have them reviewed. If you're comfortable that they're otherwise looking pretty good, even if they have a temperature, then you don't necessarily need to be too worried about that. Lots of things we've covered there today. Thank you so much for your time and your expertise. It was great to chat and have you on the show.
Thanks so much, Anthea.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.